Just heartburn. What it looks like. A burning feeling in the chest, especially after eating, when lying down, or at night. Most people assume it's reflux and move on. Why it can kill. For many people, it is reflux, but chest burning can sometimes be the heart's version of pain, especially if the sensation is pressure-like, shows up with exertion, or comes with sweating, nausea, or shortness of breath. Heart-related discomfort doesn't always feel sharp. It can feel like heaviness, burning, or indigestion. When it's cardiac, the danger is that an artery may be narrowing or closing. If that progresses, it can lead to a heart attack or lethal rhythm problems. Why people miss it? Because reflux is common and the symptoms overlap. People also tend to self-diagnose based on what's convenient. If they ate spicy food, they decide it must be GERD. And many people don't want to think about their heart, so they default to the less scary explanation. What to do next? Start with pattern recognition. Ask yourself, does it happen mainly after meals and improve with antacids? Or does it show up with activity or stress and improve with rest? If it's new, getting worse, or associated with shortness of breath, sweating, faintness, or pain radiating to the arm/jaw/back, treat that as urgent. Otherwise, if it's classic reflux, address lifestyle triggers and get evaluated if it's frequent, persistent, or waking you from sleep. The goal isn't panic. It's not accidentally ignoring the heart when the heart is asking for attention. Just tired. What it looks like. You're exhausted even after sleeping. Your usual tasks feel heavier. You're not sad, you're just drained. Why it can kill. Fatigue is one of the most underrated danger signals because it can be the first symptom of serious problems: anemia, heart failure, thyroid disease, chronic infection, uncontrolled diabetes, sleep apnea, or even cancer. Fatigue can also reflect poor oxygen delivery, either because blood can't carry enough oxygen, anemia, or because the heart can't pump efficiently, heart failure. When fatigue is the early sign of heart failure, the risk is progression to fluid overload, arrhythmias, and hospitalization if ignored. Why people miss it? Because we normalize being tired. People blame work, parenting, stress, age, screens, or just life. And to be fair, sometimes they're right. But the difference is when fatigue is new, persistent, and out of proportion to your routine. What to do next? Look for companions: shortness of breath, swelling in the legs, palpitations, weight change, night sweats, persistent fever, or unexplained weakness. If fatigue has lasted more than a couple weeks without a clear reason, the next step is simple. Basic labs: CBC, thyroid, metabolic panel, A1C depending on risk, and a clinician evaluation. Also ask, do you snore loudly or wake up unrefreshed? Sleep apnea is a huge hidden cause. You don't need to catastrophize fatigue. You just shouldn't ignore a pattern change. Just dizziness. What it looks like. You stand up and feel a wave of lightheadedness, or you get random dizzy spells that pass quickly. Why it can kill. Dizziness can come from benign causes like dehydration, inner ear issues, or anxiety, but it can also signal something more serious: arrhythmias, significant blood pressure drops, internal bleeding through anemia, or neurologic events. If dizziness is due to a heart rhythm problem, the risk is fainting, falls, and in some cases, sudden cardiac events. If it's a warning sign of a TIA or stroke, the risk is obvious. Why people miss it? Because dizziness is common and vague. People often don't describe it precisely, and doctors can't read minds. Dizzy could mean spinning, vertigo, lightheadedness, imbalance, or near fainting, different mechanisms and different risks. People also wait because it comes and goes. What to do next? Describe it accurately. Spinning versus lightheadedness versus unsteady gait. Pay attention to triggers: standing up, dehydration, missing meals, caffeine, or palpitations. If dizziness comes with chest pain, fainting, severe headache, one-sided weakness, speech problems, or new vision loss, don't wait. Otherwise, start with hydration, check blood pressure, and get evaluated if it's recurrent. A simple ECG and basic labs can catch a lot of the dangerous causes early. Just a cough. What it looks like. A lingering cough after a cold, or a cough that gradually becomes your new normal. Why it can kill. Most coughs are harmless.
but persistent cough can be a sign of pneumonia, worsening asthma/COPD, heart failure, fluid backing up, medication side effects, or lung cancer. The dangerous situations are when a cough is paired with shortness of breath, fever, chest pain, or cough that produces blood. A cough can also be a warning that oxygen exchange is compromised, meaning the body is under stress, even if you're trying to power through. Why people miss it? Because cough is common. People treat it with syrup and thyme, and if someone smokes or has allergies, they assume coughing is normal until it's not. What to do next? Watch the timeline. If a cough is not improving after a few weeks, or if it changes character, deeper, more frequent, new wheeze, or accompanied by weight loss, night sweats, fever, or blood, get evaluated. If you're short of breath at rest or walking across the room is suddenly harder, that's not a waited-out situation. Practical next steps are basic exam, oxygen saturation, and, depending on context, a chest X-ray. Just swollen ankles. What it looks like. Socks leave deeper marks, shoes feel tighter, ankles look puffy at night. Why it can kill. Swelling can be benign, heat, salt, long flights, long workdays. But new swelling can also be from heart failure, kidney disease, liver disease, medication effects, or a blood clot. The dangerous one is a DVT, deep vein thrombosis, when swelling is mainly one leg, with pain, warmth, or redness, because clots can travel to the lungs and cause a pulmonary embolism. Why people miss it? Because mild swelling is common and people blame salt or standing. Also, swelling often develops gradually, so it becomes normal in someone's mind. What to do next? Check the pattern, both legs versus one leg, and whether it improves overnight. If it's one-sided, painful, warm, or sudden, get checked urgently. If it's both legs and persistent, ask about heart and kidney evaluation, and review medications. Some blood pressure meds can cause swelling. Pair it with other clues: shortness of breath, rapid weight gain, reduced exercise tolerance. Those point toward fluid overload and deserve a real evaluation.
Just snoring. What it looks like. Loud snoring, choking, or gasping during sleep. Morning headaches, daytime sleepiness. Why it can kill. Obstructive sleep apnea is like a nightly stress test. Repeated drops in oxygen and repeated surges in stress hormones increase blood pressure, strain the heart, and raise risk of atrial fibrillation and stroke. It also increases accident risk from sleepiness. Over years, untreated sleep apnea can quietly accelerate cardiovascular disease. Why people miss it. Because snoring is socially normalized. People joke about it. Many think apnea only affects a certain type of person, and people don't connect poor sleep to serious health outcomes. They just think they're not a morning person. What to do next? If you snore loudly, have witnessed pauses in breathing, wake up choking, or feel excessively sleepy, do a real risk screen, like Stop Bang, and consider a sleep study if high risk. Treatment isn't just a mask. It can be weight management, positional therapy, oral devices, and CPAP when indicated. The goal is better oxygen and less cardiovascular stress, night after night. Just blood in the stool. What it looks like. Bright red blood on toilet paper or darker stool that looks almost black. Why it can kill. Sometimes it's hemorrhoids, but blood can also come from ulcers, inflammatory bowel disease, or colon cancer. Black, tarry stool can signal bleeding higher up in the GI tract. The danger is not only cancer. Severe bleeding can cause anemia and collapse, and delayed diagnosis can turn a treatable condition into a late-stage problem. Why people miss it. Embarrassment. People wait months because they don't want to talk about it. Many assume it's hemorrhoids without confirmation, and if bleeding is intermittent, people delay even more. What to do next? Don't self-diagnose. If there's blood, get evaluated, especially if it's recurrent, mixed with stool, or paired with weight loss, fatigue, abdominal pain, or changes in bowel habits. If stool is black/tarry, or you feel weak, dizzy, or faint, treat it as urgent. For average-risk adults, screening matters, but symptoms deserve diagnostic evaluation, not just a casual, "I'll do a test later." Just weight loss. What it looks like. You're losing weight without trying. No new diet, no major lifestyle changes. Why it can kill. Unintentional weight loss can be a sign of serious conditions: cancer, thyroid overactivity, uncontrolled diabetes, chronic infection, malabsorption, or significant depression. The danger is not the weight loss itself, it's what might be causing it, plus the loss of muscle and reserve that protects you during illness. Why people miss it. Some people celebrate it, especially if they've wanted to lose weight for a long time. Others don't notice until clothes fit differently, and many people assume it will stabilize. Sometimes it does, but it's not a symptom to ignore when it's unexplained. What to do next? Track it. If you're losing weight unintentionally over weeks to months, get a basic evaluation, history, exam, and targeted labs. Look for accompanying clues like night sweats, persistent fever, ongoing cough, GI changes, palpitations, heat intolerance, or increased thirst and urination. The right move is calm and systematic. Confirm the pattern, check the basics, and investigate based on the most likely causes.